Good evening, everybody. My name is Kathy Essig, and I'm a board member for the Northern Virginia and DC chapter of CHAD. I want to welcome you to our virtual exhibit hall this evening. We're really excited about this, and we hope you are too. I'd like to ask everybody, if you haven't already done so, please mute yourself and turn off your camera. Tonight, we're going to start with a short lecture. What do children with ADHD need to be successful? Our presenters are Shannon McCarty and Shannon Titmas from the Flint Hill School. After this lecture, you'll be able to visit us in our exhibitors in the breakout rooms. The breakout room button is located at the bottom of your screen. When you click on it, you should be able to see all of the exhibitors listed in the various breakout rooms. If you have any problem navigating back and forth from the breakout rooms to the main room, there will be two volunteers in the main room, Irene and Taylor, who will be able to assist you. If you're new to CHAD, let me take a few minutes to tell you about us. CHAD is a nonprofit organization that was started in 1987 by a group of parents who wanted to do something about the lack of support that the schools were providing to their ADHD children. From there, this group has blossomed into a nationwide organization with chapters throughout the United States. Our chapter provides various supports to our ADHD community, which are listed behind me on the screen. We're all volunteers in this organization and cover our expenses through membership dues, donations, and sponsorship. If you're not already a member of CHAD, please consider becoming one this evening. Now I'd like to introduce our speakers. Shannon McCarty currently supports teens with ADHD and learning differences as a learning specialist and ADHD academic coach at the Flint Hill School in Vienna, Virginia. Shannon works one-on-one with juniors and seniors who learn differently using a coaching approach. She holds a master's degree in learning disabilities from the American University and is also a board-certified BCC coach. She also works in private practice coaching high school and college students. For the past 11 years, Shannon Titmas has worked at Flint Hill as a lower school learning center specialist, supporting students with ADHD and learning differences through direct reading and math support, in-classroom writing support, and executive function and study skills building. Shannon supports not only students, but also teachers and parents, helping them to implement best practices when working with students of all abilities. She holds her master's degree in special education from the University of Virginia. I'm going to turn the floor over to Shannon and Shannon now, and when they complete their talk, Irene is going to get on to give more directions about moving into our breakout rooms. We hope you enjoy this evening.
Good evening, everyone. My name is Shannon Titmas. Kathy, thank you so much for that introduction.
Welcome.
I'm going to go ahead and present my screen here.
Shannon, you're on mute.
All right, let's try that again. Can you hear me?
Absolutely.
Yeah. Okay, good. Welcome, everyone. And again, thank you for that introduction. We're excited to be here with you tonight, and we just want to thank CHAD for organizing this event.
About $12.9 million.
Please mute your, yes.
As Kathy shared, we both work at Flint Hill School in Oakton, Virginia as Learning Center Specialist. And you get two Shannons for the price of one tonight. So. We thought we'd start this evening with a mindful moment. We often start our one-on-one and our group sessions with students just by giving them a chance to center themselves, take some deep breaths, in through the nose, out through the mouth, to kind of calm their bodies and get ready for what we're about to either present or practice with them. And if you guys have had a day like I have, it would be great to just center ourselves for a moment. I took this picture today on a hike with a large group of fourth graders. I had a brief moment of being able to enjoy the fall colors. So I'll give you just a few moments to take some breaths, enjoy the image if you'd like, and then we'll move on from there. Go ahead and take your last breath, and we'll continue on. So we want to just start talking today about ADHD and really the broader impacts that it has, which is often why you come to something like a resource fair. We're potentially preaching to the choir here. You as parents understand that ADHD has more than just an academic impact for your children. This image is particularly helpful because it really gets into all the underpinnings of the social, emotional, and academic things that may be impacting your child at different stages in their developmental life. And Shannon's going to kind of start on the next slide and break down the 3 essential things that can be really helpful for all children, but especially those with ADHD, as you begin to tackle what exactly does your child need to kind of meet his or her potential and be as successful as possible.
Hi, everyone. So the reason you're here tonight is to try to figure out, to seek support for your child and to help them meet their full potential. Tonight, you're going to see a number of fantastic service providers who provide a number of different kinds of resources. So our goal here tonight really is to talk to you a little bit about how to navigate all of these services that are available. We are so lucky to live in the Northern Virginia area where there are a plethora of fantastic coaches and therapists and behaviorists and schools and psychologists who have a deep, deep understanding of ADHD and the comorbidities and learning differences that are often seen in our kids. And so what do kids with ADHD really need to be successful? Well, an important part of that is an informed parent. And if you're here tonight, you are absolutely an informed parent. You're here to gain more knowledge and to gather some up-to-date, more relevant information. And you are your child's or young adult's best advocate. So congratulations to you and thank you for being here. You're taking a wonderful step toward improving the hopes for success of your child. Multimodal treatment is another very important component of success for children with ADHD. Many, when they hear the word ADHD, they immediately think, oh, I have to put my child on meds. Well, it's a really effective treatment, but meds alone are not the silver bullet, hence the number of resources that are available to you tonight, because we know that a combination of treatments really is the most effective form of treatment for a child. And we want that treatment to be tailored to meet the needs of the child, the family. And we also need to keep in mind that that treatment plan is going to change over time. As your child grows, as they mature, their treatment is going to have to adapt and change with them. And so all of us caregivers, treatment providers, teachers, coaches, really need to expect that this treatment process is going to be ongoing and dynamic and in many cases, lifelong. And then we also know that children with coexisting conditions like anxiety or who have other external stressors, or if there's high levels of conflict in the family, are going to do best with that combination of treatments. And so we really need to look at the whole child, everything that the child is experiencing, needing, what they want, especially as they get older, and really considering the most suitable treatment for them, and consulting everyone on the child's team, doctors, psychiatrists, coaches, if you have them, and anyone else in the school who is giving you information as you look to make the best choice for your child.
I think in addition to that, when we think about the whole child model, we also want to, you also, and we as service providers want to think about harnessing the child's strengths. You know, where do they feel their best selves? Where do they find the most success? Perhaps it is in an academic area and perhaps not. So I think as you consider treatment options for your child, although they may benefit from a tutor 5 days a week, that would mean they couldn't play lacrosse or something like that. And that is not in your child's best interest either. So I think it's about balancing what your child needs for their mental health, as well as what they need to be successful in other areas of their life. One of the supports, or you may encounter 3 different types of supports as you are navigating how to best support your child with ADHD. And we've categorized 3 of those as coaching, tutoring, and counseling, because there's a lot of overlap, but there are distinct differences with each of them.
Yeah, and there is often a lot of questions, sometimes confusion, especially around the difference between coaching and tutoring. So we just wanted to take just a quick minute to talk about some of the key differences. And in coaching, the student really is at the center, and the coach and the child, the teen, are building a trusting relationship. The coach is curious about what the child needs. The coach doesn't tell the child what to do, whereas a teacher or a tutor would be guiding a student toward gaining academic skill. While a student gains academic skills, often in coaching, they do it through goal setting and through supporting the child to move forward with what their individual plan is. Coaches are curious. Coaches ask questions. They don't tell. They come from a place of a child being whole and well and in charge of their learning. They do a great job at developing kids' executive functioning strategies. And really there's a huge focus on building self-awareness and metacognition. And they really focus on staying in the present and looking toward the future. I won't spend too much time on tutoring because many of us know what tutors look like. But Shannon, you want to jump in on that part?
Sure. I think the only additional thing that I would add is that tutoring, like we said, focuses on typically an academic area and can often provide a remedial support to a child. And that can be beneficial throughout a child's entire academic career. For coaching, that requires a certain level of maturity and metacognition, and not elementary age children are not always ready for that. Every child is unique, so there are some that are open, but that I find that parents often are in more of a coaching role with younger children just because of where they are developmentally. The final piece on this particular slide is around counseling. And I think one of the things that helps differentiate counseling from a coach, obviously lots of degrees as well from the service provider, but it's really helping both the child and the parents process what they're experiencing and what they have processed in the past, so they can build strategies to move forward and have more positive counselors will help identify and solve problems with their clients, and that's much like coaching too. It's that, but they're dealing with perhaps trauma in a different way. Anything else to add, Shannon?
Yeah, actually, if you are lucky enough and find the need for both a coach and a counselor, particularly in high school students, a coach and a counselor really can form a wonderful sort of triangle of support for your child. They can work together around areas of motivation and procrastination, and really trying to get to the root of some of the challenges that a teen, especially I think a teen or college-age student with ADHD might experience. That can just be a really wonderful opportunity for some really, really deep, important work that can have some really long-lasting benefits.
Another support that your child may benefit from, and really looking at the family, is behavioral therapy. And by that, I am specifically talking about working with a specialist around your child's behavior. When it comes to younger children, that often looks like working with having the specialist meet with parents, coming up with strategies for the parents to implement, and then coming back to both the specialist and perhaps even a parent group where they're reflecting on, what they've tried, what's working, what's not working. And it's really about how the family works around the particular child. There are other cognitive behavior therapies that work specifically with the child and the family as well, that are more in depth and done by counselors too. Is there anything else you would add to that, Shannon?
No, I don't think so. Thanks.
Okay.
And then another an important type of support is social skills training. Many of us are familiar with the book, It's So Much Work to Be Your Friend. And we know that our kiddos and our teens with ADHD can have some real challenges with picking up on social skills, keeping friends, being unreliable, overreacting. All of those common ADHD traits and characteristics can make having and keeping friendships challenging. And it's so hard as a parent to watch your wonderful, awesome kid struggle on the social front. So social skills groups can be really wonderful and really effective. They're typically small groups. Kids learn particular skills around conversation, around how to gain self-awareness around friendships, how to notice how someone reacts when I do or say something. They might work on scripts for having particular kinds of conversations. Help other kids, might help your child gain some window into how people are perceiving them. And what you really want to look for when you're seeking a social skills group is one that's specific to your child's particular issues. There are tons of these social skills groups out there for kids on the autistic spectrum, but not so many for ADHD kids. So you really have to seek those out, and you want to keep the group to about the same age. And there are sometimes also gender specific groups if you think that would be the best match for your child.
So it brings us to the question of, how do you know, if there's all these resources out there, what exactly my particular child needs? Because that's as a job, your job as a parent is to focus on your particular child. I think keeping in mind that you're the expert on your child is really important. You know your child best, and you've watched them since they were young and how they've grown and changed over the years. So keeping that in mind, but it's so important to bring in your team of people, and your team may be as small as the parent and the teacher, or it could be larger. You may have additional caregivers, a nanny or a babysitter that your child often works with, doctors if your child comes up with a doctor, both regular general education and special education teachers. Every child's team looks a little different and is a different size, but considering all of their perspectives can be incredibly helpful when you're asking yourself, what should I do next, or what should I do right now? And that kind of leads us to the developmental stage piece of things, because what your child needs as a first grader with ADHD and what your child needs as a freshman with ADHD, although I'm sure sometimes you feel the same level of frustration, is going to look vastly different. Children, when they're very young, may need more behavioral supports, may need more of that academic support as they're gaining early skills, and that can switch to more of a goal-setting coaching, perhaps mental health support as they get older. But every child is unique, and there is a spectrum of what they may need along the way. Keeping in mind both your child and your family at the center of things will be very important too. And we touched on this earlier, in that we want to keep the child, all the pieces of your child at the center, and make sure you're not forgetting about what matters for your child, as well as what you know is going to help them in the long run. And also what's manageable for your family. There may be times where you have to decide between, like, okay, the main thing I need to focus on right now is learning how to read. So I'm going to hire that reading specialist instead of working with, the counselor for, the next 3 months, and then we'll reassess. Oftentimes, families have to make that call because you just can't do it all sometimes. And it's important to think about what the most important thing is right in that moment for your child. And that leads us to being strategic. You don't want to just throw darts at a dartboard. You want to be really, really mindful about taking that next step. So you're not trying so many different things all at once that when you start to see a shift in your child's behavior, you don't really know why it's working or what's happening. And that's where you can go back and work with your team to figure out what is the most strategic thing to do at this time.
And I think the only other thing I'd add there is that this is a marathon and not a sprint. It's going to take a while to see the changes that you and your child and your family and your educational providers are hoping to see. And so being consistent, sticking with it, even when it's hard, when you see that behaviorist and they're asking you to implement a behavior plan that might just feel overwhelming to your family, just break it down one thing at a time and be consistent and stick with it, because in the long run, it will be worth it.
I think just lastly to add that Shannon and I have had a lot of shared students over the years, and with me working with the youngest and her working with the oldest, it's been really beautiful to see where they've started and how successful they have done as they've grown and changed. So I also find such joy in seeing that and knowing in my heart that it really, all the different things that you as a parent are doing and so the team as a whole make a huge difference for a child moving forward. So thank you for your partnership, because I think that you being here is such a great gift to your child, even if they don't know. We do have our resources listed that I think they'll be pushing out our slides. I'm going to stop screen sharing for the moment because I know we're going to transition in a second over to the resource fair. Shannon and I are going to stay on in the main room if you guys have any burning questions for us as well.
Okay, thank you. So this is Irene. We are going to